Good morning, everybody. It's Dr. Brace here. Welcome to Facial Plastics Friday. Last week we talked about lip lifts and how lip lifts are an adjunct to a facelift or it can be a procedure on their own. Today I want to talk about chin implants, which also can be an adjunct to a neck lift, a rhinoplasty, or a procedure done on their own. And so what is a chin implant? A chin implant is literally exactly what it sounds like. It's a piece of silastic rubber that goes in under the skin onto the chin and lets the chin projection increase. And so who's a good candidate for a chin implant? That would be the person who feels like they have a weak jaw and they want it to be stronger, usually a man, or a woman who wants to have a sharper neckline because they have a smaller chin and they want more projection to get more of a Nefertiti type neck where you have a nice sharp neckline. The other candidate would be somebody who feels like their nose is big, but in reality, they may have a slightly enlarged nose, but it's because their chin is small, and with a small chin, the aesthetic balance of the nose gets thrown off. And so somebody with a large prominent chin will look like they have a smaller nose. Somebody with a recessed smaller chin will look like they have a bigger nose. And that's because when your chin is recessed back, the curvature of your face kind of comes in, and so the most prominent point is your nose. It looks like it sticks out further. When you bring the plane of the face forward at the chin, then the nose looks more balanced. And so a chin implant is a pretty simple procedure to do. It involves an incision right underneath the chin right here. Sometimes incisions done through the mouth, but I like to keep away from the mouth bacteria. So when the neck is all prepped and sterilized and draped in the OR, make a small, about 2 centimeter incision right here. The skin and the tissues are lifted off the bone, and the chin implant is slid in right along the lower border of the mandible. And like I said, it gives you more projection. My favorite type of chin implant is what's called an extended anatomical chin, a Conform extended anatomical chin. That's this guy, and they look very natural because they have these tapered edges. And so the tapered edges will actually sit out here, and if you do have a little bit of a jowl forming, it actually pushes the skin forward there and gives you this nice sharp lateral jawline, nice projection, nice sharp jawline. But chin implants come in different sizes and different shapes. If you were a man who was looking for a nice square chin, then we have these square chins or vertical lengthening chins. This is a mandibular groove chin, and they come in all kinds of different shapes and sizes. So I use Implant Tech from California. These are the guys. So we have a whole binder full of different implants. And when somebody comes in for a consult for a chin implant, what I'm doing is assessing how much projection they need, what shape they're looking for, and then what implant is the best. One of the advantages of the Conform extended anatomical chin is that I can shape it in the OR. Because this is silastic rubber, I can cut it. So if you have a little bit of jaw asymmetry, you're more prominent on this side but weak on that side, we can actually cut it so that we don't enhance this side at all, and we build up this side to build symmetry. One of the rules, one of the things with chin implants to know for any of the surgeons or residents out there is there's a 70% rule. If you have an implant that sticks out a centimeter, the actual projection you're going to get is about 7 millimeters. So you only get 70% of the projection. And that's because it's placed on the bone and there's a little bit of bone resorption as the implant kind of settles in. And so you always have to go a little bit bigger than you think because you're not going to get the whole implant's projection when you size somebody up. So that's a chin implant. It can be done in the operating room with a rhinoplasty, commonly with a face or neck lift, and sometimes just on its own. If you have any questions for us about implants, chin implants, cheek implants, anything like that, send them our way. Everyone have a great weekend and happy Facial Plastics Friday.